Do you know what malaria is and how it affects us? Malaria is a life-threatening disease, a formidable foe that we have been battling for centuries. It's not just a fever, a headache, or a bout of chills. It's an insidious enemy, hiding within the human body, waiting to strike when least expected. This disease is caused by parasites, tiny organisms that invade our red blood cells. These parasites are transmitted to people through the bites of infected female Anopheles mosquitoes. These mosquitoes are the silent carriers of this devastating disease. A disease that has claimed countless lives over the ages. However, it's not all doom and gloom. Malaria is preventable and curable. With the right knowledge, precautions, and treatments, we can effectively combat this disease. The fight against malaria begins with understanding it, knowing its causes, its symptoms, and its cures. Understanding malaria is the first step towards prevention and cure. Did you know malaria isn't just one disease but several types caused by different parasites? Here's the scoop. Malaria is caused by 5 different species of a parasite called Plasmodium. Each species brings its own brand of trouble to the human body. These 5 are Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malaria, and Plasmodium knowlesi. Now, while all 5 are problematic, it's Plasmodium falciparum and Plasmodium vivax that really steal the show. These 2 are the most common and pose the greatest threat to humans. Plasmodium falciparum in particular is notorious for causing the most severe form of malaria, often leading to life-threatening complications. On the other hand, Plasmodium vivax, while not as deadly, is the most widespread, especially outside of Africa. By understanding these different types of malaria, we can better grasp the severity of each type and the appropriate treatment methods. Knowing the types of malaria helps in understanding the severity and treatment methods. Ever wondered how malaria spreads and what you can do to prevent it? The culprit behind this disease is the tiny Anopheles mosquito. When it bites a person infected with malaria, it picks up the parasite Plasmodium. The next person this mosquito bites may then be infected with the disease. Quite a devious little creature, isn't it? But fear not, there are steps we can take to protect ourselves. Using insect repellents can significantly reduce the risk of mosquito bites. If you're in a malaria-prone area, sleeping under a mosquito net is a good idea. It's like having a personal shield against these pesky insects. Another precaution is taking anti-malarial medication, especially if you're traveling to a high-risk area. These drugs can help prevent the disease by killing the parasites in your bloodstream. Remember, it's always better to be safe than sorry. Prevention is always better than cure, especially when it comes to malaria. So, you've contracted malaria. What happens now? Well, first things first, don't panic. Malaria is treatable, and the key to successful treatment lies in early diagnosis and prompt medical intervention. The typical course of action involves anti-malarial drugs, which work by killing the parasites that cause the disease. These drugs are often given in combination to increase their effectiveness and prevent the development of drug-resistant parasites. The specific medication and treatment regimen will depend on several factors, including the type of malaria, the severity of symptoms, and the patient's overall health. Remember, time is of the essence when dealing with malaria. The sooner you start treatment, the better your chances of a full recovery. And while we're on the subject of prevention, it's worth reiterating that the best way to avoid malaria is by taking precautions to prevent mosquito bites, particularly in areas where the disease is prevalent. To sum up, malaria is a serious but preventable and treatable disease caused by parasites. Stay informed, stay safe.